All right, so today I wanted to talk a little bit about what's known as regional interdependence. And basically, the whole point of this is kind of how either your main complaint can be affected by other stuff that's happening in your body, or how it can be caused, your main complaint can be caused by something else that's going on. And a lot of times, it's maybe not causing the main issue, but it sets you up for, now we have a weak spot. Okay? So basically the whole idea with this, and this is going to be a short thing because I figured people may have questions afterwards about their own personal stuff, so I wanted to leave plenty of time for that. But basically what it is that the idea that your body parts rarely function on their own. So when you're walking, your whole body is involved. When you raise up your arm, you're not just raising your hand up in the air, but your elbow is doing things, your shoulder's doing something, your neck is doing something, your torso is counterbalancing. So everything that you do has effects further on down the line. So I want you to try just a quick little thing. If you put your hand like right at the top of your thighs here, okay, and just kind of see if you can feel where the muscle kind of, where the hips really kind of come into that. And so you're going to try to feel like right in there, right? Okay, so right on the top, you've kind of a little bit of a pucker there, right? A little okay. So now try and lift your foot, one foot. Did you feel it move? Mm-hmm. Yeah. Okay. Yeah. So if you just lift your foot, your brain isn't thinking, it's not thinking, I have to lift up my knee, extend my knee to lift the foot. It's thinking foot in the air, right? Okay, so that just kind of gives you an idea. Something, you're thinking about your foot, but your brain is activating things all the way on up the chain. Make sense? Okay. So most of my patients come in saying, you probably won't believe this, but I think this all started back in high school when I... And actually I do believe it. Because I think that, that twisted ankle or that knee injury or something, probably your body compensated for it. Not all of those compensations go away when the injury is healed necessarily. And so you kind of have these compensations as we put more miles on the body. We have more compensations on top of compensations on top of compensations, and pretty soon you kind of run out of room to compensate. So the question is, why does this happen? There are several theories, as you can see. I think I went all the way down to F, and I was thinking about it last night as I was trying to go to sleep, and I thought of two more. So there's quite a bit of them, really. But one is, load sharing, and basically that just means that the stress of one muscle contraction is spread to the tissues that are around it. Okay, so the force of the muscle contraction here gets spread to the forearm, it's spread to the shoulder and the neck. Okay, so all of it is dispersed over a large area. If you can think of an example of this, is when you grind your teeth. If you grind your teeth, you feel the tension here in the neck, you feel it up in the head, you feel it pretty much, all the adjacent tissues. So it's not just, people come in with TMJ and they chew gum all the time, and it's like, well, I want you to take, you have headaches and you're chewing gum, I want you to feel up here what happens when you chew. Well, you feel that contraction of the muscle. Yeah, so chewing gum, this is just one example. I'm not saying don't chew gum, but it's one of those things where we don't necessarily think about it causing neck or head pain, but it can. So the next is fascia, and this is similar to load sharing, and it's one of the ways that we do load share. But fascia is the connective tissue that surrounds all of your body structures and kind of connects everything. Okay.
It's like that thin layer over chicken.
Yes, yes, it's that thin layer. When you peel the skin off, it's that thin layer of silvery stuff that's between the skin and the muscle. And so that goes throughout your entire body. It actually is one of the reasons why they think acupuncture might work, is because you are connected with fascial lines from here to your shoulder. And we have a big one, a big fascial line that comes from the shoulder up here down to the hip. And the purpose for that is when you're walking, we do opposite arm and leg when we walk, right? As we're here, the fascial line is shortened here and it has tension here to keep you kind of more upright. Okay? And it doesn't let you go, all the way. It has a stop to it so that you're not going to overreach. So we have, fascial lines that they've been able to trace from all the way down to the very bottom of your foot, all the way up to your head. And so it connects all the way through. And so if you have a twist or a pull in one part of your fascia, you can see how it transfers that all the way across the shirt, right? And the same thing kind of happens with the body. So this particular, when you have chronic pain is a danger signal, and your body mobilizes resources to help fix what's going on. It sends repair crews to the area that has pain. That's inflammation. That can make the fascia sticky. It can make it pull. And one can exert as much as 2,000 pounds of pressure per square inch. So yeah, no wonder it hurts, right? That's a lot of pressure. So that twisting and pulling of the fascia can really also increase pain as well. The nervous system is another one, and of course this is, there's actually several ways that the nervous system is impacted with pain, or with your neighbors next door, if you have hip pain. One of the ways is that your body actually really knows, without you having to think about it, thank goodness, that if you can't put weight down on one leg, it's got to compensate by putting more weight down through the other leg. Okay? So not only are you pulling up on one leg, but you're putting more pressure down through the other. Okay, so there's a whole system of compensations, and the cerebellum in the back part of your brain is actually really responsible for coordinating all of those things. So when you have an issue where I can't use, say, the rotator cuff to lift my arm up, okay, you can lift up, you can you can lift with your shoulder, you can lift with your toes if you need to. So there's a whole lot of different compensation. Most of the time we don't think about it. We just, yeah, I guess I am doing that. People don't realize that when they have back pain, they tend to walk a lot differently. We tend to, and I'm gonna pop right up again.
Okay.
We tend to, when there's low back pain, we tend to walk very cautiously, almost like we're walking on ice, right? Okay. What that does is that changes the entire biomechanics of the whole system, right? Your brain is automatically compensating that to keep you upright. Am I making sense? Okay. So it's not just the low back, but all the way down the chain.
Hamstrings, the whole shot.
The hamstrings, and so I get a lot of people with low back pain that have pain right through here, and golly, does it ever keep them up at night?
That hurts.
And they
Yes.
mistake it for sciatica, don't they?
What's that?
They mistake it for sciatica.
A lot of them do, and it's because this muscle here and these muscles in the calf are supposed to go through a contract, relax, stretch, contract, relax cycle. When you take a nice big step forward, there's a stretch and then a contract and then a relax as you pull through. When you don't get that, the toxins in the area don't get cleared the way they should. And that bogs down the system, irritates the nerves, causes a lot of pain.
When you say toxins, what kind of toxins are you talking about?
I'm talking about the like lactic acid and other waste products that are created when the muscle uses energy.
Right.
Okay.
That's what my therapist talks about all the time. She tells me, do not do anything when you get home. Just go lay down and see that my life doesn't permit that very much. But she tells me if you don't, these toxins are loose in your body now.
Uh-huh.
And I'm like, yeah, whatever. You know, and I respect her, but that's what she's taught. And I'm like, where are all these toxins coming from? And then she started listening to me.
Uh-huh.
And it's like, you're kidding me. That's in my body. She says, you need to quit the soda now.
Yeah.
So,
Yeah. There's a lot of them we put in, you know, but there's a lot of them that are just a natural byproduct
Right.
of our
Uric acid, things like that.
Yeah,
things that cause
metabolism.
gout.
Yeah. So that's, you know, but you know, I tell people in terms of what to do after therapy, if they feel really good, resist the urge to go and do everything. But I don't tell people to go lay down necessarily either. I would tell them, you know, kind of your normal activity levels is probably okay. But I do tell people to drink a lot of extra water to help, because now the toxins are loose.
That's exactly what she says.
And so, you know, if extra water will help that kidney to flush that
water.
system. Then tea or coffee. You know, I know that the conventional wisdom previously has been that the caffeine is a diuretic, and so it's going to dry you out. But you know what? The water is the liquid. The water is still going.
I would agree with you. I think that dehydrating. There's a small amount of powder in there.
Yeah, it's really not. They have you know, the big they. I've read studies where they've looked at how much dehydrating the caffeine is compared to the amount of water that you get in coffee or tea, and honestly, if that's the way you're going to drink it, that's the way you get water through the system, go for it.
The only thing I really see any conclusive evidence on is like hard liquor. Hard liquor will dry you out. That's why people get headaches.
Yeah, that is part of that is because things that it does to the blood vessels and the blood within the blood itself
Not
is
good for you.
It's really no, it's not.
But water would be the best.
Yep.
Water would be the best, but you know, I can't really argue with, you know, and if you like soda, how I managed, I got off of soda, but how I did it was I drank a lot of seltzer water with juice. So you know, half and half,
or the fizz, huh?
so you get the fizz, because that's a lot of times that's, you know, people need that, I don't know, that stimulation down their throat to feel like they're drinking something.
I just did research that told me it's real bad for my voice to drink soda, and that's what I do during a job. I mean, I always break down and have Diet Coke all night.
Yeah.
Then you're looking at aspartame,
Yeah, that's
citric
some nasty
acid.
stuff.
And then, if you do have stuff with sugar, there's a school of thought that this, I'm trying to think of, they call, it's cornstarch. A type of cornstarch.
The high fructose corn syrup?
Yeah, that is like not good for you. When you start looking into that, pancreatic cancer as a result of chronic use of it, but they're all about this aspartame now.
Yeah, personally, I'm kind of a, if it's something that somebody came up with in a lab, it's probably not good.
If they're wearing white coats and gloves to handle it.
Well, yeah, right. Well, there's that, but there's, you know, I mean, to me, it's like if nature didn't make it, then it's probably a reason why.
Right.
That's
I'm
my
in no
thinking.
danger of diabetes, so
Right.
I use sugar in my tea.
Yeah.
And my tea glass is this tall, that big around. So
So whatever the upshot of that is, whatever you use to hydrate yourself is fine with me. I'm not going to quibble about stuff like that. I just want you to hydrate. Okay, so that's the nervous system. That's one of the ways that the nervous system compensating, helping you to use one side of your body over the other one. The other way that the nervous system, there's two other ways. One is referred pain, and the other is radiating pain. Okay, so most of us have been in the point where we do have sciatica, where something pinched up here creates pain down the line. Okay, and that's because there's a direct connection between the nerve here, you know, and here. The thing about that is that I want you to understand that we always want to treat the spot that actually does have pain as well as other places.
good luck.
Okay, because, you know, the body and the brain, as sophisticated as it is and as amazing as it is, if it locates pain here on the Google map in your head, where is it going to send the repair crews? It's going to send them down here. So chances are pretty good that you have, especially if you've had it for a while, the sciatic pain. If you're not treating on down the line, if you're not treating the area that the brain is sending the repairs crews to, you're going to have scar tissue and sticky fascia and all kinds of stuff that's going to cause issues down here too. Okay. The other one, the last one, is referred pain, and this is kind of it's a hard one to describe, but this is often people get it when they have heart attacks. They feel the pain down their arm, or ice cream headache. That's another really good one.
Oh, yeah.
When you eat ice cream and you have the forehead, you're like, oh, right? And that happens because, and this is the way my brain looks at it, is that when you have a highway going somewhere, you have all these cars on the highway, you don't actually know where they got onto the highway. Okay, so the nerves at the back of your throat and the nerves in your forehead share the same highway to the brain. They're just different on-ramps. And so by the time it gets to the brain's really not certain where it got on at. And so it picks the most likely place.
Yeah.
Okay, so we don't have actual pain receptors within the heart itself, but we have a message of danger from the heart, and it connects with the heart. I'm poking over here. I'm so smart.
Well, I don't know that whole thing.
I'm so
makes
used
my
to
face
doing
ache
everything
over
backwards. I'm so used to doing everything backwards because of everybody's mirror. But anyway, so the heart is here. By the time that danger signal gets up to the brain, it has connected with a common on-ramp over here. And that's why people often will get pain here, or nausea, or some other things, because it shares the same on-ramp. It shares the same highway, not the same on-ramp. Okay, so those are ways that the nervous system can impact where you feel the pain versus where your main problem is. Biomechanical position. This one is very, very common with shoulder pain, and people will come in with posture like this and have shoulder pain. Okay, and the biomechanical reason for that is that if you're here, okay, and you raise up your arm, you have a bony stop here from your scapula, from your shoulder blade, that's going to keep you from going up any further. But what happens if I sit up straight? Now all of a sudden my range of motion is normal, right? Mm-hmm. Right? So if you're here and you're constantly trying to reach up as far as you think you should be able to, you're going to keep pinching that shoulder. Okay? And the thing that happens a lot with the way people walk, with the way people stand. I was talking to somebody earlier today about how a lot of us look like we're coming off a ski jump when we stand up. I was gonna wear biking shorts for today because I'm doing a lot of body stuff, but then I was like, nobody needs to see that. They think Beyonce, or not Beyonce, but if they think Lady Gaga's got extra on her, then I ain't gonna try
I don't
that.
care.
We're talking about standing. A lot of us have a tendency to kind of stand a little bit forward, like we're coming off the ski jump.
Mm-hmm.
That can come from a lot of different things. Usually there's some sort of restriction here in the front. But you think about how much that body has to work behind here. All the muscles posterior have to work to keep holding you up, to keep you from really going off the ski jump, falling forward, right? So the muscles back here get really, really tight because they're having to hold you up, and you'll see a lot of people have their glutes really engaged. They'll be really pulled up, okay?
That only happens in court.
Trust me, I see it a lot. But anyway, I get your point. But so if we can biomechanically get you to stand up more straighter, then those muscles don't have to work as hard, and you don't get that hip pain that's associated with.
So posture's about everything.
If it were, then nobody in the military would have back pain, and all 90-year-old ladies would. Right?
Well, when they have us on a line for 2.5 hours holding a flag at attention, oh yeah, your knees. I had a guy, we had to literally lay him down in the yard because his knees got so bad.
Yeah, and so I mean, I'm not going to say that posture is everything, okay? Because there are a ton of people out there with really, really poor posture and they don't have pain at all. And then there are people with excellent posture, dancers, who have a ton of back pain. So I'm not going to say this to everything, but it definitely helps if you can reduce the loads on the body tissues by having good posture. It can help things be more efficient and heal better.
So can building muscle fix this?
Yeah, it can help. But at the same time, if you have like really short pectoral muscles and so you're pulled in here, strengthening these guys back here is not going to help at all. Okay, the idea that I heard recently was if you have a board here, and on one end you have a spring, so it's kind of like this. So you have this spring that's here, and you want to lift this end of the board. You have two choices, right? You can push down here and stretch the spring, okay? But that adds more tension to the entire system, right? Or you can release the spring and raise the board, okay? That decreases the amount of same total end result, but so which one do you want to do?
Right.
So my goal a lot of times is to find where those restrictions are and release those, so then now the muscles can work, and instead of trying to work against both gravity and tight muscle, now we can just work with gravity to hold you upright. Does that kind of make sense? So yes and no. Yes, more muscle strength is definitely a good thing, but you don't necessarily want to have to keep trying to fight against something that's happening on the other side of your body. Okay. All right, so functional movement, and I demonstrated this earlier when I was talking about the nervous system compensating. Functional movement, the brain does not think in terms of, I need to use X muscle to do this and that and the other thing. It thinks in terms of, I want this end result. Okay, so if I'm going to reach up into a cupboard, but these muscles back here in the rotator cuff aren't working correctly, and I can't get it to move up and through, okay, it's going to lift here, and then I'm going to reach, and then I'm going to, step onto, get up onto my toes. So I'm making compensations all the way through. Well, what does that do to your neck? So I've had people come in with just horrible pain from like here to here and over and up, okay? And they've had this bad pain for a long time, and we work, and finally she's like, okay, now we're just down to this here and this here. And then she's like, we worked for a little while longer, and then she was maybe about 2 months in, and she went, about 8 years ago, I was moving a mattress, and I hurt my shoulder. Well, she ended up going to get an MRI, and sure enough, there was some issues with the rotator cuff in the shoulder.
With a rotator cuff, if it's bad, can you lift your hand straight up?
Some people can.
Really?
Yeah.
See,
we don't know why.
They're telling me.
You don't know why. All right, last one of the reason why we have this regional interdependence is joint by joint, and this is known as also the stability priority, and basically keeping you upright is a huge priority. So a lot of times people will have a super loose ankle, and then the knee locks up to compensate for the ankle being loose. So if you had, as a kid, if you twisted your ankle real bad, it didn't ever heal really well, and so you have this really floppy ankle, then what happens is a lot of times not only the knee, but the hip will then tighten up, so that instead of being like this when you're moving around, okay, now you've got less range of motion down at the ankle, and so the ankle is actually the cause of your hip or low back pain, because these two stiffened up. Now this one's taking extra. This one is taking, to all to compensate for this ankle that you twisted when you were a kid. Okay, so that often will happen for people, and we don't figure that out until we've beaten a dead horse. We keep looking at the same spot, and finally I'm like, "Do you got anything else going on with you?" And they're like, "Oh yeah, this knee's been bugging me for ages." I'm like, let's treat the knee, see what happens, and all of a sudden they can walk,
Right.
And now their back doesn't hurt anymore because they're not doing this thing, which is all back to compensate for the knee. So the point of all of this, in learning all of this and talking about all of this, is that if your doctor, your physical therapist, your whole team should be very interested in your theory. If you think that some of this has to do with, gosh, yeah, I screwed up my neck, but when I fell, I probably also, hurt the rotator cuff. But that never got treated because the neck was such a big deal. But maybe the neck is continuing to hurt because I'm doing this all the time instead of this, right? So your doctor, your physical therapist should all be interested. If they're not, find a new one.
Do you think maybe I should have that rotator cuff worked out?
I think so.
Because
Sounds that way.
he's blending it all in the neck right now. And he's a good guy. He's an osteopath.
It's this is something that I'm not going to say, I haven't missed stuff before because I have.
Right.
But a lot of times, if you're kind of beating that dead horse, if you keep getting treated for the same thing and it keeps coming back, you have to ask yourself why.
Well, yes,
Why does this come back?
He says does it hurt in your arm when you cough? I'm like, yeah.
Well, so there probably is stuff happening in the neck.
Oh, yeah, there is.
But we are allowed to have more than one thing wrong with us.
Right.
Right? And I mean, most of us have multiple things. Like you have the trifecta, and we all have stuff that's going on. We all have stuff. So more than one thing going on. And so my thing is like, okay, you have managed to get through a couple of major episodes with your neck.
Oh, yeah.
But then it comes back. Why? All right, so my upshot of basically your doctor or your physical therapist, whoever, should be really interested if you have a theory on why something is still continuing to bother you, why something's not getting better, and say it. And if they're not paying attention to you, it may be time to find a second opinion or find somebody who does pay attention. So think back through your life, and any accidents or injuries that seem like they have healed may be a clue.
But like rotator cuff, I had rotator cuff surgery, and you think I'm not going to hurt anymore. Wrong.
No, you're wrong. you can still have pain with that.
Yes.
But some of it may be okay. So then, is there scar tissue
Yeah.
that's pulling in one direction or another that's making the whole thing not function correctly? So you can work that out and stretch that out and get that to not bother that joint quite as much. So that's my presentation for today.
It was
That's
awesome
pretty
as
much-
usual.
Good. I'm glad. Anybody have any other questions? Anything else? Is an Australian physical therapist, and I went to go see him talk when I was still in PT school, and I was like, ding, 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 this is it. This is my calling. And he talked for 3 hours about pain, and it was amazing. And he's a great speaker. He's super funny. You can find him on YouTube. He's awesome. But the thing that he said that really struck home with me is that of all of the interventions regarding pain, we grade interventions by how well they work and how many people they work for.
Right.
Okay? So all of the interventions, physical therapy, pills, injections, surgery, any of that stuff, the thing that absolutely works the best is education. Understanding what's happening to you.
Yeah.
Understanding what you can do about it.
Well, who wants to read about it? Though? It hurts.
Right? Weird people like me. But so the whole thing is that the biggest thing that I want for people to at least leave, if nothing else, when they leave my office, they have a better understanding of what's happening. That takes away a ton of the fear. Fear increases pain. Fear increases that whole arousal system. If you can take that down, you can take down, if maybe you're not taking the pain down, but you're maybe taking the suffering that goes with the pain.
Right.
And that's a huge part of the pain experience. So, that's really what I want.
Well, like in that MRI, man, it was like, okay, this is about as much as I can take. I don't think I can do any more. What did she say last week? Oh, Girl from Ipanema, come on, man. Seriously. Stupidest song in the world, and I don't know the words.